Welcome back, my friends, to the Marc Claire Show. My guest today is a psychotherapist, host of the Be Yourself and Love It podcast, and he is the author of a free ebook, which you can get over at 7bigpharmamyths.com. It is called 7 Big Pharma Myths
It's
Debunked.
just 7 pharma myths. It's
What did
just
I say?
7
I can't
pharma
even.
myths.
What did I say? 7 Big Pharma Myths? Okay. Well, I can't even get to the
Yeah,
intro
the book is
without
called
messing it
7
up.
Big Pharma Myths. See, I'm such a big mouth that I have to come in and talk over you right at the beginning of the show, Mark.
Well, that's how it goes. It's all right. But please do welcome the Scot himself, Antony Sammeroff. How you doing?
Hey, I'm doing really well. I've never been in the Marc Claire show before, but I did Lions of Liberty quite a few times.
Yes,
So some of your
times.
fans might not know me yet, but
that one debate is still discussed to this day. The debate with the Marxist professor. That's one of my more talked about episodes.
That was a really good show. Thank you so much for that. That was a really good show, and I really enjoyed doing that. I debated Richard Wolff on Lions of Liberty. I appreciate that, and we met in Mexico.
Indeed.
And
I
think
at the Sayulita Festival put on by our friend Johnny Profita.
That's right. And I think we were going through a period of being quite changed. Like a lot of us, Marc Claire and Antony Sammeroff, pre-COVID versus after COVID.
I think that is safe to say. So why don't we start there a little bit? Because at the time when I met you at this event in Mexico, this was, I want to say, the end of 2021. Does that sound right? And so you had already left Scotland, I think, shortly after the COVID stuff happened and had been traveling around. So why don't you tell us a little bit about that? What you were doing in Scotland, like when all that stuff went down and when you kind of looked around you and said, this is not where I want to be right now. So tell us a little bit about your travels over the last couple of years.
Yeah, and this is obviously relevant because we're going to talk about the ebook 7 Big Pharma Myths Debunked, which you can find at 7pharmamyths.com, the number 7pharmamyths.com. And yeah, I would say that COVID was instrumental in me deciding to focus on this topic rather than anything else I could have written about. So it is relevant. Yeah, so I was chilling in Scotland. Lockdown came in, I think, March of 2020. I'd not been back long from India, actually. I was intending to go back out to India, but I was pretty tired back then. It's quite interesting because I traveled on and off for a few months, and that was tiring for me. I actually ended up traveling for 18 months. Now, that's quite interesting because it completely changes your perspective on what's a long time. And I learned to embrace the digital nomad lifestyle. So some good came out of it for me. But the circumstances were pretty weird. Like, I guess I thought that lockdowns were nonsense from day one. But a couple of friends, even my libertarian friends, were saying, well, you don't seem to be taking it very seriously. So I thought, well, Zika, SARS, Zika, what else did we have? Yeah, exactly, all that stuff. I was just like, here we go again. So I was pretty surprised when they locked down. But, I kind of enjoyed it for the first few weeks. And to my shame, I even posted to Facebook after a couple of weeks, the only thing that I'm not enjoying about lockdown is that we can't go out for a drink to celebrate lockdown. And I was kind of kidding.
You're so lucky I didn't see that status, Antony.
I know. This is like 2 or 3 weeks into it.
Or maybe I
was being cynical because I didn't really agree with the lockdowns, but I was enjoying just the weird change of pace. And I am ashamed of it. I deleted it when it came up on Facebook memories, and I deleted it off Instagram because I was like, what the fuck? Who knew that it was going to go on for so long? So things opened up in Scotland, and I had a girlfriend that was based in Florida, and she came over to see me and spent 10 days in Scotland, and things weirdly started to bring in curfews again. And I was like, what are you talking about? We just opened up. And so I went so my plan was to go and stay with her for 6 weeks, kind of like see if it was a goer. Do you know what I mean? Because there's no point having a long distance relationship unless it's got a future. And
it's a shit or get off the pot situation from the beginning.
Correct. So it's like, let's find out if this is going to work. Yeah. Okay, so in order to do that, I had to spend a month in Mexico. Well, I actually needed to spend 2 weeks in Mexico because you couldn't go to USA directly from Scotland because of COVID regulations. So you could go to Mexico City and attend a crack party and sleep with hookers.
Which, as
I'm
I'm
not
sure
saying that
you
I did
did.
that, but yeah, exactly. And
Well, so you had to go
exchange
to
all
Mexico
sorts.
for your cleansing first. You know, once you spent the 2 weeks in
Right. Okay.
Mexico,
Yeah.
you ate enough tacos, you sweat it all out, and then you're safe to come in.
Right,
Science.
exactly. So there was absolutely no logic to that regulation, but that's how it was. So I thought, okay, I looked up a yoga retreat and I went there for 3.5 weeks, and I did that before going to Florida. Now it was a very lovely relationship, but I didn't see a long term future, so I didn't know what I was going to do. I knew I didn't want to go back to Scotland because they were still in lockdown, so I just went back to the retreat,
Could you
and
even
then
have
I
gone back
started.
in at that point? Did they have a vaccine mandate?
This was long before the vaccine had been developed. Actually, what I really wanted to do was go back to India because I'd spent at least 6 months in India before 2020, and I really wanted to go back and do all the stuff that I usually did. But I just thought, well, maybe they'll be open next month. Maybe they'll be open next month. Maybe they'll be open next month. Ended up back in the States. Went to a couple of libertarian events. I made friends with Stephen Kinsella, um, the author of Against Intellectual Property in Houston,
The
and I
very
went to
first
something in the
person I
Mises
ever interviewed
Institute.
on a podcast ever was Stefan
Oh, that's
Kinsella.
very interesting. There's a little
Historical note.
synchronicity. I feel like it's synchronicity that I met him because I was meant to go to Idaho, but the person I was going to meet there, someone I was collaborating with, ended up going to Houston. So I went in Houston instead, and I met Stephen Kinsella there. We got on really well, went to a couple of libertarian events, and I found out that I was a little bit famous in the USA. So that led to a whole kind of tour of libertarian events. And I was just kind of
Libertarian
waiting.
famous. Let's not get too confused
Yeah,
here.
libertarian famous. Libertarian famous is
Something.
better than nothing, Marc. You
That's
must
true.
know
That's true.
this.
I know it all too well.
Right. So that's it. So I started going to different libertarian events and a lot meeting people, and people said, "Oh, you should come and visit here. You should come and visit there." And if enough people said that, and I had enough Facebook friends based in that city, I'd make my way over and see if I could create a little meetup. And back then, I wrote the book "Universal Basic Income For and Against," and I flogged that at meetups to which sometimes made up for the cost of my airfares because flights were really cheap back in those days. And so, even though on the whole I was out of pocket, I definitely wasn't out of pocket in love. And I don't think I would have been able to do the tour without, you know, certain, um, without. I wouldn't have been able to afford to do the tour without the support of the libertarian community because people would pick me up from the airport or put me up for a couple of nights. So it was really awesome and it was a fun time. And I learned a lot. And I learned a lot about traveling and I became more of an adult because you keep on making mistakes and fucking stuff up. And then you have to learn how to do stuff properly. Fast forward a little while. I
That's
met
I
you.
don't want to gloss over that. That's such a huge part of traveling and getting out and doing things that are uncomfortable. And it's I think so
Right.
many of us get into our comfort zones, myself included. I've been in comfort zones and
Mm-hmm.
been forced to get out of them. But almost always, as you're kind of laying out here, when you are forced out of your comfort zone and traveling for 18 months, that's way the fuck out of anyone's comfort zone. I don't care how much you love traveling, how much you like being on the road. Like 18 months is a long, long
Yeah.
time, and you're gonna make a lot of fumbles along the way. But I mean, the strength building you get out of that is just off the charts.
Yeah.
There's no question there. I'm just
Yeah. So
ranting.
I'm thankful for that. And to tie it into the COVID mania, it's like that's exactly what people didn't do. Do you know what I mean? Lock people in their house. A lot of people said, I don't even go out anymore to social events and stuff like that since lockdown because I got out of the habit of doing it and my
Mhm.
social anxiety got worse. And now I don't want to go to events. I met people who've told me that. So I guess it's a thing. It's, you're either growing or you're dying. You need to,
Mhm.
you broaden your horizons and um, expose yourself to situations that are anxiety provoking, and then you grow as a human and you become more competent and more apt to deal with the situations in life, or you shy away from challenge and you become less apt and less able to deal with life situations. And this ties into the big pharma stuff as well, because even according to official sources, with the exception maybe of antibiotics which kill pathogens, but then again, should you be doing that? Should you, if it's life threatening, probably, but maybe if it's not life threatening, what you should do is allow your immune system to handle it so that your immune system becomes more robust. Secondly, I guess, hormones, if you've had a organ removed like your thyroid, you might need those. Well, no, you will need those. So, but apart from that, most medications do not cure diseases. They just mitigate symptoms. So, um, again, this is like we've been indoctrinated to see any discomfort in life as something that needs to be avoided, taken away, and so forth, and so on and so forth. A lot of the diseases that people use medications to mitigate can be changed, can be reversed with lifestyle changes, um, but they won't be reversed if you simply make the symptom go away while you don't deal with the underlying cause. If you've
Mm.
got a nutritional deficiency, a mineral deficiency, no amount of aspirin is going to make that go away. If you're dehydrated, it's amazing when you think about it, because we know that one nutritional deficiency can cause an untold number of diseases, but when you go into the doctor, they don't check to see if you've got any. Um, Dehydration itself, most people are dehydrated because we eat a lot of dry food, toast, tacos, corn chips. You don't really see animals in nature eating dry food except for like cashew nuts and well, nuts in general, so which aren't absorbent. So it's quite interesting that uh, but we can get into that kind of stuff maybe in the smoke filled room. uh, but it's an interesting thing, the way this like general trend of, like, I mean, for example, we're sitting on chairs all the time. This causes a lot of the back problems allegedly that people get later in life. When you go to indigenous cultures like in India, where I've been, or Mexico and stuff like that, people sit cross-legged, or they don't lose the mobility in their body. They can work over their head. They work on trees. They can weave above their head. I'm just higher than that, higher than I'm putting my arms. We lose these abilities because of modern living, and then you don't want to do it. You put your cereal boxes in your cupboards where you can reach them. I heard a mobility teacher say in a podcast, deliberately put your potatoes down where you have to bend over to pick them up. Put your stuff up on the shelves where you have to reach out for them. Because if you
Mm.
constantly continue that behavior, then that will make a big difference when you're older. If you want to be able to get off the toilet when you're old without someone helping you, get squatting. This is not trivial. This has a massive um, effect on what the end of your life is going to be like. But you're not going to hear that from the doctors, and you're certainly not going to hear it from the pharmaceutical industry. So that's my quite labored segue.
I mean, I've seen this kind of thing firsthand. I mean,
Thank you.
I have relatives who've had cholesterol problems, and instead of looking at their
Mhm.
diet or even asking them about their diet or even thinking about their
Right,
diet,
right,
they jump immediately to these statins and whatnot. And then
right.
turns out a couple of years later, oh, I'm having these problems. Why? Because of the statins. So they and then, oh, well, we have some drugs for this. So it becomes a
Right.
chain of drugs without ever actually addressing. The doctors never even bring up why you had the problem in the first place or what the root of the problem was in the first place. So it just becomes a series of chasing symptoms and then chasing reactions to other drugs, and it's horrible to watch in real time.
Thank you so much. And statins are a perfect example. In 1999, the Lions Heart study demonstrated that a change in the diet could lead to 70% less heart disease. And back then, they had overrated the benefit of statins. Now, the prevailing cultural view that people are not willing to change their habits certainly helps the medical industry sell statins. But the thing is, the data on them is terrible. Like, this is what they call preventative medicine. What they keep on doing is putting more and more healthy people on statins. Now, medical researchers like John Abramson, who wrote Sickening and Overdose America, Meryl Guzner, the author of the $800 million pill, actually wrote a letter signed by 35 physicians and researchers to the National Institutes of Health, correcting serious errors in their meta-analysis of the data on statins, right? And encouraging to update their guidelines in line with the best evidence available. But and that's evidence-based medicine, right? I want to talk about that in a minute. What is evidence-based medicine? What happened was, when the next set of guidelines came out, they recommended statins to even younger and even more healthy people, right? So the problem with that is cholesterol is a risk factor. Lowering the risk factor is not the same as changing the behavior that established that risk factor at the same time. Conditions to manage your blood pressure. Now a big one is your weight, right? They're actually giving people injections to lower their weight and saying, well, if you're obese, you're more likely to get this set of diseases. So obviously, if we reduce your weight, then you're less likely to get those diseases. Not necessarily. And the worst thing is,
because the weight could just be a symptom of your diet and whatever Correct. It may be that are leading to all the other problems.
Yeah. Yeah, exactly. So what you're actually doing is you've correlation does not prove causation. They tell us that all the time. And yet you can get medications approved on the basis that they change risk factors. In the book I'm writing, the bigger book, one of the examples, the most egregious example of this is you can get a cancer treatment approved without proving that it improves patients' length of life, quality of life, or any of their patients. Actually, you can prove that you can get a medication approved without proving that it improves the quality of life or length of life of the patient, just so long as you prove that it shrinks a tumor. There's one big problem with that. Oncology literature is absolutely filled with studies that say tumor shrinkage does not guarantee better patient outcomes. They can die of the treatment. They can get a secondary infection. They can bleed to death. The tumor can shrink for a couple of weeks and then grow back even quicker than ever and kill them, right? So even by their own freaking admission, right? So this is what I love to do in my writing on Big Pharma, which is I love to demonstrate that even if you go to their own sources, they admit the worst of it. You could find even worse, maybe you could find even worse information in conspiracy theory websites and publications and stuff like that. And some of the conspiracy theories must be true. But all I do is dig around and find what the official sources admit. And I've got tons of citations and stuff in the 7 Pharma Myths book.
Today's episode of the Marc Clair Show is sponsored by right here, Fox & Sons, foxandsons.com, my favorite coffee brand. And I don't just say that because they're sponsors of the show. I say that because I get a 1 pound bag shipped to my house. The proof is right here. Every single month, I get my pound of Fox & Sons delivered right to my house. You should too. Of course, I don't expect you to just dive right in with no idea what you're getting into. I want you to go get yourself a sample bag. Go over to foxandsons.com, foxnsons.com. You can check out the Den Blend Dark, as is my preference, the Tanzanian Peaberry, Brazilian Honey Premp, a bunch of other flavors still to come. Steven's always mixing it up with new, fresh beans. The best part about this business, Steven started it to not only relive his love for sharing coffee with his father, but to teach his own sons about entrepreneurship. If that doesn't give you the warm and fuzzies, I don't know what will. Just kidding. Yes, I do. This coffee will. So head over to foxandsons.com, foxnsons.com. Use discount code MCS to get yourself 18% off your order. You're going to be coming back for more. Trust me. foxandsons.com, discount code MCS. Back to the show. Well, I first want to discuss a little bit how we got here. How did we get to the point where how the pharmaceutical industry operates, where it doesn't actually have to operate based on outcomes, based on patients actually living longer or patients actually getting better. How is this industry? I mean, if the car industry, for example, if the end result wasn't your car works, but maybe like a headlight works better, but the engine blows up when you leave the lot, it would never work out. Mm-hmm. But for some reason, this whole industry basically does the same exact thing, and billions of dollars in profit, maybe trillions. So how do we get here?
Yeah, there's so many factors to that. You can look at it historically. You can look at it in terms of who funds the institutions. You can look at it in the individual level and how sort of people's attitudes collude, although people's attitudes are informed or let's say misinformed, right? So, for example, when you look at the news in America in the evening, the vast majority of ads or pharma ads. And I naively thought they were trying to sell drugs. But actually, it turns out this is how they buy favorable coverage. Because in my research, I found that there's hundreds of drug withdrawals every year, wrong dosage on the bottle, or for any reason, right? So really, the news could cover a pharma scandal every day, right? And then people would be absolutely terrified of using pharmaceuticals because there'd be so many scandals. But there are very few reported. There's even been so many instances of drugs being litigated against because they were illegally advertised for indications that they weren't proven for, and what all sorts of stuff. And the doctors go on prescribing them because they don't even know that the company was taken to court and sued for one of them was Neurontin, also known as gabapentin, for I think it's bipolar, for example. They were taken to court, still widely prescribed for that indication, even though there's no evidence to back it up. So when you look at where the funding, so people are misinformed. The university system, the pharma companies write the textbooks. You get blackballed if you don't. If you go up against them. I had a girlfriend in Mexico City who's a doctor, and she said, I never go to conferences that aren't funded by pharma. I mean, why would I? I'm not going to go into my own pocket and pay to go to a conference, but we need so much continuing medical education a year. So obviously I need to do it. So I'll go to a conference knowing that it's funded by pharma. And the doctors think, yeah, I know that it's funded by pharma, but I might as well, you went through 10 years on the poverty line during doing 70 hours a week before you even started getting paid. You feel like you're entitled to make back the money and enjoy a nice resort and listen to some lectures. So you think it's not going to change your prescribing habits? Put it
that way, that there is probably some sort of sense of like, well, maybe I know this system is a little bit corrupt and I kind of know it's not right per se, but God damn it, I worked my ass off for so long. I earned that degree on the
You're right.
wall. I earned
Exactly.
this license. I may as
Yeah,
well get mine.
exactly. Yeah, exactly. And that's one of the reasons why, in my opinion, they put people through this gauntlet to become doctors. Because by the time they come out the other end, they're so invested in the system, they're the last ones to question it. And I've got doctor friends who inform my research, and some are awake, and others are part of the mainstream system, but still help me get insights into things. And I find them, and because I can speak the language to a degree, they can be quite um, informative. And they, well, I mean, I've had people say, doctors aren't that smart. I mean, they're smarter than average, but they're not question askers. They believe in the cult of authority. They've earned their authority, and they've been educated by organizations they believe have earned their authority. And it's like, you do what the authority says. Do what your doctor says. When I was a kid, and I went, once a doctor asked to prescribe something for me, and I said, okay, well, I'll just go and have a little look online first. And he went, okay, then, doctor. And I was shocked because I thought he'd be happy that I was taking an interest.
That you want to see
But
what's
actually,
in this thing he's recommending.
yeah. So the other thing is a wrong historical view of things, which is people have the misperception that pharmaceuticals are cause of the disappearance of diseases, which they're not the cause of the disappearance of. So, as you know, our grandparents and our great grandparents suffered through all sorts of polio, tuberculosis, whooping cough, rickets, scurvy, Spanish flu, etc. And most people think that this has reversed due to pharmaceuticals and that we're living longer due to pharmaceuticals. But as I demonstrate in my book, according to mainstream sources, most of this happened due to public health advances. So here's one from the CDC. The average lifespan of persons in the United States have lengthened by greater than 30 years since 1900. 25 years of that gain are attributable to advances in public health rather than medicine. And of that 5 years, the majority, they say, is down to preventative medicine rather than pharmaceuticals. So one story I love to tell is in the, every year, people in New York used to get scurvy and yellow fever because New Jersey in the 1800s, early 1900s, were just a swamp. Like New Jersey was a swamp that bred mosquitoes, and every summer the mosquitoes would just fly across the river and start infecting people with malaria and yellow fever. But the rich people would just pack up their stuff and move somewhere colder, right? And then it's still the case that being poor today is hazardous to your health. You're more likely to get diabetes. People live in these in flats with are more likely to live in flats with mold, and they don't have a social network, and blah 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 blah. So it's really access to clean drinking water, better nutrition, and all these things. They used to have these horse-drawn carts going through before the invention of the car, and the horses would just crap on the streets, right? So people lived in small flats, many people to an apartment. In fact, the average living space per person doubled in America as recently as between 1973 and 2014. So the mainstream doctors would like to take credit for the disappearance of all these conditions, but even we've got I cite the American Academy of Pediatrics as well, who put it down to public health. So this is just like mainstream. It's admitted by mainstream sources, but most people don't know it. So when you actually look at the effectiveness of pharmaceutical medicine, given that we're the most medicated people of all time, you have to tell me If pharmaceutical medicine is so amazing and successful, why is diabetes skyrocketing? Why is Alzheimer's disease through the roof? Why is obesity off the charts? Why is arthritis? Why is everyone getting it when they get old? Why is cancer? Why are you so much more likely to get cancer now than in the 70s? Why have more people got multiple sclerosis, lupus, asthma, migraines, ADD, ADHD? Um, Pharmaceutical medicine has failed to reverse even a single one of the long-term chronic diseases that we are the most likely to suffer from during our lifetime. So that is, those are some of the myths that I give you mainstream sources to proselytize your friends at the 7pharmamyths.com, the ebook you can get there.
Talking about the last few years, I think it was very obvious that a lot of people, many of which for the first time, were starting to have their eyes opened a little bit due to the V, so to speak. Maybe we'll still be a little coy. I think you're pretty safe on YouTube nowadays. But due to the vax and whatnot, the COVID vax and everything that went on with that, a lot of people did start to become skeptical of it. I think the push was so strong that many people were.
Lollipops.
What's that? The lollipops, the Twinkies, the donuts, the lollipops, all of it. But one thing I would often hear from people is that, okay, well, yeah, I'm not going to take that. But they would often default to the, but I know these other ones, all these childhood ones that we take, I know those are all good. I've taken all those. Of course I'm going to give my kid those, but this one. So right. I'm curious your thoughts on the truth to that. If this round was so obvious and so glaring that a lot of people were seeing it, how much of what went on before just hasn't come to light for many people?
Right. Okay. Well, I'm not going into great detail on injections in this particular book, apart from to say that the Academy of Pediatrics in 2000 published a study in their very own journal Pediatrics, which stated very plainly, and I quote, "Vaccination does not account for the impressive declines in mortality," we should add to that, witnessed in the 20th century. But that in fact, nearly 90% of the decline in infectious disease mortality among US children occurred before 1940. That's to say, long before most of the antibiotics and vaccines were invented to help account for the achievement. So tuberculosis had already plummeted by 1945, which is a year before the development of streptomycin in 1946. And the same goes for these other diseases that are attributed to injections. Now, I'm not going to tell you what to think about this. Just put it this way, right? See if the CDC wants to demonstrate that we're all a bunch of crazy anti-vaxxers. It's very easy to do. All they need to do is there's 800,000 completely unjabbed people in the USA. So why not do a study of the long-term health outcomes of vaccinated and unvaccinated populations? Take 10, 20, 50, 100,000 of these people. Let's see how much diabetes they have. Let's measure all of their chronic illnesses and then age adjust it and compare it to the same number of completely vaccinated people. Now, the CDC have been asked to do this study. They refused to do this study. Not only that, anyone who's tried to do this study loses their position at university and is blackballed. There was a pediatrician of Dr. Paul Thomas who did this study in Oregon, and the next day the Oregon Medical Board found an excuse to take away his medical license, which obviously wasn't down to him making this study, and he had to take them to court to get reinstated. James Lyons Wheeler, who I should be teaching a course on the economics of healthcare reform. More on that later. We'll mention it. We'll mention it in the end if that's something that you might be interested in. He designed that study, and despite being a top researcher, there's also has been blackballed. There's Anthony Mawson, who did a similar study and was is now retired because the university ran him out under pressure. So why are they so reluctant to compare long-term health outcomes of vaccinated and unvaccinated populations? Surely they would want to demonstrate that we're insane.
Right. Right. And doesn't it sort of I mean, because the unlike a lot of other drugs, they don't really need to, or maybe not drugs. The drugs would be the wrong example, but unlike a lot of other industries and a lot of other products, that industry overall doesn't necessarily need to prove that they're not causing harm of some kind, because they have such a sort of a safety net, I guess, if you will. So maybe you can speak on a little bit of that stuff. I know the book itself doesn't focus on as much of that, but I think a lot of people aren't aware of the fact. I think a lot of people think, well, if these things were causing harm, whether it's whether it's injections or some kind of medicine, if these things were causing harm, surely we would know about it. But there's a reason we don't.
Well, you're right in the sense that pharmaceutical drugs have to be tested against a placebo, and vaccinations don't. And they've got other ways of manipulating the data when it comes to drugs, right? I can go into some of them. I do go into some of them in the book. But with vaccinations, people are saying that it's the adjuvants that are causing harm. Now, adjuvants are toxic chemicals they put in deliberately into vaccinations because they say, what we're giving you is an attenuated or a weakened virus. So to give you a more robust immune response, we're going to put some poison chemicals in it, and your body will, like people think, if you smack a dog while it does some behavior that you don't like, it'll give the dog the impression that it shouldn't do that behavior. It's kind of like conditioning. In the same way, your body's going to freak out, and it's going to associate the robust immune response with this vaccination. But I don't really think that proves anything. I mean, you could just say that it's you're having an immune response to toxic chemicals, right? So they go, oh, well, there you had a robust immune response. No SHIT. And we're the ones that are anti-science.
Yes,
when they don't even test their product against the placebo. Yeah, right. So the thing is, what they'll do is they'll test the virus. If you, and there's a whole another Pandora's box we could open, right?
It is maybe in the smoke filter room,
not against the placebo, but against adjuvants. Right. Okay. Well, against the adjuvants. Now, if the adjuvants are causing or another vaccine, right? So if it's the adjuvants that are causing a problem, that's not a placebo trial. In addition to that, they don't test the whole vaccine schedule for synergistic reactions. So they'll do these individually, but it's like, so another thing is, as you probably know at home, if you've been paying attention, you can't sue a vaccine manufacturer for poisoning for a vaccine injury. They created this whole special other court that you have to take back the vaccine companies to, and the government pays for it if you win through the tax system. But unlike in normal court, if a vaccine has caused a certain contraindication, a certain condition before, in a normal court, you'd be able to use that as a precedent and go, look, for example, these breast implants caused this problem to women before, and it was proven. We've got a case of it. See? So it's likely that it's done it again. You're not allowed to do that in the vaccine courts. So even if your child gets a condition, you need to start from scratch and prove that it was the vaccine that caused it all over again, without going, look, there's a precedent here.
So there could be 100,000 kids with the same response, and they would say, well, that has nothing to do with this.
Right. Okay. So given the sheer amount of doohickery that's going on, it's amazing that anyone can look at vaccines and not go, I smell a rat, right? I'm not going to say that they're harmful. I'm going to say, just look at the research and the data and ask me why no placebo trials? Why are they not doing a long-term study of vaccinated versus anti-vaccinated populations? Why are they not safety testing the vaccine schedule as a whole? Like, just do the science. All I'm saying is, do the fucking science. Right.
Is there one myth or one particular maybe fact you can toss out there that you think that a lot of people that are already skeptical of the pharmaceutical industry, people like you or I, people that already might have skepticism over injections, is there something that you think even they will be surprised to find out?
Specifically about, I mean, I've thrown out my most surprising stuff about injections. I think there's, I mean, pretty much everything I cover should be shocking. I think the thing is, people have the impression that what's going on when it comes to medications is science, right? The sheer number, the sheer number of ways that I think, here's the thing. I just think, like, if according to official sources, right, medications are the third leading cause of death in the USA. So when you say um, when you look at the cost benefit analysis would shock people, right? So about 128,000 a year die from taking properly prescribed pills. We're talking about people who just did what their doctor said, right? But then again, the same die because of dosage errors or the use of a drug that's contraindicated for them, or they got given a drug that they shouldn't have taken with another drug that they're taking, and so on. So that makes up to 250,000 a year. But then not everyone who's damaged by a drug dies. So every year, 840,000 hospitalized patients are given drugs that cause serious adverse reactions. And that makes up for a total of 2.7 million serious adverse drug reactions. So when they say that anything is safe and effective, one of my myths is that pharmaceutical medicine is safe, the other that it's effective, right? Hospital acquired infections. According to the CDC, they kill 100,000 people and cost 25 billion a year to treat. Now, experts at Johns Hopkins were able to decrease the number by 82% and save nearly 200 million in treating hospital-acquired infections. But the thing is, the private hospitals don't have any incentive to stop this from happening, because when they looked at it, hospital-acquired infections generated around $45,000 more in profits than patients that didn't. So I'm not saying they're there trying to give people hospital-acquired infections. I'm just saying they don't have the incentive to stop it from happening. And we're libertarians, we're into economics. The the fact that everything in the medical industry, all of these people are making money. Pharma reps don't do anything to improve the quality of care. The only thing they're there to do is convince a doctor to prescribe their medication rather than their competitor's medication. People just want the best treatment with the best evidence, not advertising, right? There's all these hangers on making money. And we were told in economics, a system tends to produce the results that it's incentivized to produce. And that's what it does. What you would Let me put it this way, Mark. If I was your financial advisor and I said to you, I've got a great idea for you, right? Anytime your account goes up in value, yeah, I'll make money, but I'll make even more money if your account goes down in value. But don't worry, if I kill you, then I'll lose it all. You won't have to pay me anymore. You'd be like, get the fuck out of here, Antony, you sociopath. But that is the incentive structure of the system. The sicker you get, the better, just so long as they don't kill you. So the incentive structure says we'll make the most money if we get people to be chronically ill and treat them for years and years and years and years, as long as possible, and get other people to pay for it, healthy people to pay for it through the tax system.
Hmm.
And that's exactly what we get. So being a libertarian gives you some insight into this that maybe someone coming at it from the left and being like anti-corporate or anti-pharma wouldn't get. I mean, those used to exist a few years ago, I'm sure. Yeah, you know what I mean? So what we're getting is what we're paying for. We're paying for the treatment of chronic illnesses, and that's what we're getting.
I'm curious what I want to try to look at what a positive solution that people can try to come to with a lot of this stuff, because I think when you start diving into this topic and you start to, it can be like diving into anything. It could be like going down a particular conspiracy rabbit hole as well, where there's so much coming at you. There's so much information. There's so much, oh shit, everything is bad. Every company's, corrupt. They're out to kill me. Their medicines are killing us. What is one to do? And how do you sort of navigate that system and try to come up with your own health solutions that maybe don't reject all of the mainstream? Because I'm sure there's a lot of actual, real, true things in the mainstream medical industry that really do work, but there's a lot that is causing harm. How do you navigate that system without falling into what I think can also be some maybe dangerous rabbit holes in certain areas of the alternative health area? I'm not saying that alternative health is bad, but there are probably certain rabbit holes you can go down that could also cause poor health if you make bad decisions on that end. So if you can't turn to the doctors, you can't turn to the system. What are you supposed to do besides, choose your favorite internet crackpot?
Right. Okay. Well, I mean, first of all, make me your favorite internet crackpot and get my book from 7pharmamyths.com. But yeah, I mean, look, I'm a really big fan of stuff like fasting, intermittent fasting, juice cleanse. Like, I believe that a lot of you create vulnerability to the disease based on the underlying cellular condition of your body, right? So, in the fundamental level, there's three things that create vulnerability to disease at least. One is nutritional deficiency. So that means more fresh produce, organic preferably. Who knows what they're spraying with it? Who knows what they're even spraying their organic produce? High water content food, which means fruits and vegetables. Secondly, sorry, where was I? Secondly, so first, nutritional deficiency, and there's various things, stuff like algae, spirulina, chlorella, which basically is so full of minerals and things like that. And chlorella in particular has a detoxification property. Because our soils are depleted. So again, coming back to the thing about there's so many levels of analysis. So on the personal level, you need to make sure, one, that your body's getting what it needs to create healthy tissues, and two, that it's not got stuff in it that's poisoning it. So unfortunately, largely because of the system we have, processed food's got to go if you don't, are minimized if you don't want to get sick later in life. These things gather up in the cells and compound. And I've got some suggestions in the 7 Pharma Myths book. I can't go through everything. There's things that you can do to help your body get rid of stuff that it doesn't need. These are more kind of things that I want to discuss with people. If they get on my Substack and whatnot, I'm going to be on locals, like in my private community, like solutions. Because another thing is, you can, if you're not in a private community, you can get arrested for practicing medicine without a medical license. Someone I know he was fasting people in Maryland, and the Maryland Medical Board sent a message to him saying, you have to stop fasting people because you're practicing medicine without a license. And he said, well, according to your own guidelines, practicing medicine is prescribing, treating, and diagnosing. And I'm not doing any of that. So treating means with surgery or pharmaceuticals, and I'm not doing any of that. And they said, yeah, but people are coming to you and getting better, so you're practicing medicine. And he said, I should have said, well, if people are coming to me and getting better, then I'm definitely not practicing medicine. um, so one is your body getting everything it needs to create healthy tissues? Two, is there anything in it that is preventing it? Like, heavy metals, microplastics, processed food. You need like digestive enzymes and stuff like that to start breaking down the residue from processed food. Because processed food is basically food without enzymes, right? They take the enzymes out so that they can put it on the shelf for a long time. That means you can't break it down because it's not got the enzymes in it to break it down. It's like, stay in touch. Stay in touch if you want more information in this stuff. Make an inquiry, right? Because you can't go through everything. Then the third one is emotional and psychological disturbances. And then some people believe, in energetic disturbances as well. This is going back to chi in the East or prana in India, the energy system. So that's a possible fourth. If you believe in that stuff, if you don't, then that's fine as well. You just call it emotional and psychological disturbances, because we know that stress reduces functionality and things like that. So one is, you need to take this shit into your own hands. Unfortunately, during my research, and I talk about it in the up and coming book, there have been successful programs that stopped people from getting diabetes and heart disease. But they stopped them because the private hospitals lost money when they prevented disease. So the private hospitals didn't have any incentive to continue to run them. So this is the problem. Because the thing is, this shouldn't be a solo mission, Mark. Unfortunately, it is. It shouldn't be a solo mission. We are social creatures. We get fat together. There's studies that demonstrate social contagion. When they take people, if you have an obese person, the more close a person is to them, the more likely they're to be obese as well. So and they showed that it's not just because birds of a feather flock together. It actually, people influence each other. So I know we're libertarians and we're individualists, but look, this society pays for people in many ways to treat illness after the fact. So it's subsidizing negative behavior. It's encouraging people to be sick because that's how they make their money. Now, I think somewhere or another in a libertarian future, we would find ways on the free market to internalize all these external costs, because chemo can run $250,000 a year or more. Hundreds of thousands of dollars could a heart attack could cost. So rather than go, it would cost a fraction of that to just bribe people to go on a program. It's like, we'll freaking pay you to go on the program and we'll fine you if you don't go on it, because that will be cheaper than treating your chronic disease once you develop one. So it's not that we don't have the money. If America had a similar healthcare system to Singapore's, and their healthcare system, which is less good and has less good outcomes than Singapore's system, supposing they performed equally well, instead of spending $4 trillion a year on healthcare, America would only be spending $1 trillion a year in healthcare. And that's without even fixing the fact that a lot of people are being treated for all sorts of, with all sorts of treatments that don't even work. And so we've got tons of money. We've got tons and tons of money to prevent disease. It's enough money to balance the budget and keep conservatives happy, and to pay for social security and keep liberals happy, and still have enough left over for a nice tax cut. So it's not that we don't have the money, it's the money isn't being spent correctly. It's going through the system the wrong way.
Anthony, well, one more thing I want to kind of dive into you with a little bit. Maybe it's not something you just it might not be a 5 minute topic here, but I just want to get your thoughts a little bit. You kind of mentioned the cancer industry a little bit, and
Mhm.
it's something you hear a lot. You hear a lot of on both ends of things. You hear a lot of people that say, well, they have the cure for cancer, but they just don't give it to us because they want to milk all the medicines out of us.
Mhm.
What is your thoughts about the overall, I guess, the veracity of the mainstream approach to cancer, and like where in all this matrix does cancer come to the forefront, where it's one of the just the leading causes of death? That I'm not saying it wasn't around 100 years ago, but it certainly wasn't around like it's around now.
Yeah. So, I mean, I think my feeling is it's like the same as everything. It's extreme um, toxicity along with nutritional deficiency over a long period can uh, causes damage to the organs, and they can't cope. Like, as we always hear, everyone's got cancer. The question is your body um, getting rid of the cancer faster than you're generating it? Now, I've spoken to people who've gone into remission, as they say, who claim to have cured their cancer. I've gone to the Gerson Therapy Clinic in Tijuana. The Advanced Gerson Therapy Clinic, the person who ran it kindly put me up for a few days because I told him I was researching the book, and I learned from him. And some of those people reverse cancer. Now, it's not easy, and sadly, in some cases, a lot of damage is done to the system, and people don't recover from it. However, when you look at, I've got a lot of official sources saying very pessimistic things about their own treatments, and um, that's coming out in the up and coming book. So maybe we'll do a part B when it's available, if you're happy to do that part two. But if you look at it, they say that Gerson therapy is quackery and it doesn't work and blah, 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 blah. That's, by the way, the juicing and the coffee enemas, pancreatic enzymes, and it's a whole protocol. I won't bore you with all the details of the therapy. You're not allowed to administer it in the USA. You need to go to Mexico. Now, the thing is, they've got mainstream cancer treatments that are not more effective than it, but the government, Medicaid, Medicare, and private insurance will pay for those, right? Despite the absolute dreadful failure. Now, I'm not saying it works for everyone. When you watch the documentaries, which you can, there's in one case, let me see if I can remember. One of the documentaries is called The Gerson Miracle, and the other is called Beautiful Truth. And they're 4 years apart. One's the Gerson Miracle is like 2004 and won an award, and the other's in 2008. And you can see the same woman come in emaciated with terminal ovarian cancer and given 6 months to live. And 4 years later, the difference will shock you. So you can see right there that Gerson therapy works for some people. Now, they make it like it works for everyone. And definitely for a lot of people, that kind of more lots of juices, kind of vegan-ish diet is best on cancer. And then there's another group of people. That's why you can't do one size fits all with cancer, who seem to need red meat in the diet and things like that. And there's a group of those people who recover too on a different protocol, the Gonzalez protocol. So this is the thing. It's not one size fits all. In a sane society, we'd go, oh, that's very interesting. Let's put a lot of money into finding out what protocols work for whom. There's a bunch of treatments that have various level of backing in the scientific literature. Let me see, like the lateralite treatment that the actor Steve McQueen went to in Mexico. And people love to bring that, Steve McKean went to Mexico and he died of cancer, of alternative treatment, like as if people don't die of mainstream cancer treatments all the freaking time. A lot of the time, the doctors shouldn't say you've got 3 months to live when you get cancer. They should say, we'll kill you in 3 months. Because a lot of people go, I'm not doing that. Like Warren Zevon, who was told he had 3 months to live, and he went, no way I'm doing chemo. I've got an album to record. I'm going to finish it before I die, and went off and lived 2-3 years, right? According to Steve McQueen's friends and family, he didn't die because of the cancer treatment. The cancer treatment actually did reverse his cancer, but then he went to get cosmetic surgery and to have the non-cancerous tumor removed from his belly. And then it was the cosmetic surgery that killed him. I don't know. The thing is, there's various things that if you're obese, if you don't take exercise, if you get a lot of radiation, including radiation from medical scans, if you consume a lot of drugs, if you're under a lot of stress, you're less likely to be able to survive cancer. But there's various things in like chaga tea, mistletoe, burdock, these Cooley's toxins. There's curcumin and turmeric mixed with ghee and black pepper. Um, there's some scientific literature to support it. So what we would be doing is to go, how can we combine what we know and find out, who can reverse cancer? The thing is, ultimately, prevention is better than cure. If you want to have a 1970s or even better, a 1923 rate of cancer, risk of cancer, rather than a 2023 risk of cancer, then you need to live a bit more like people did then, which is mean like less processed food, living food with living enzymes in it. That means uncooked fruit and vegetables, because the enzymes will help your body function. If you get animal products, get them from a butcher. Don't get the ones that are at the deli, because they're treated with all sorts of chemicals. Get fresh, get stuff, the minimally processed and minimally toxic food that you can find, and bless and give thanks before you eat your food that you even have access to food, that you even have food at all. Because a lot of people living in the world today, and most people living in the world in the past, did not have access to the brilliant selection of foods that we have now. And so if you approach your food with that kind of reverence and thanks, I believe that has and slowly enjoy your meal, then that will have a massive impact on the way that it affects the system. So prevention is better than cure when it comes to cancer and heart disease and everything.
And everything. I think that's good advice no matter what we're talking about. Anthony, it's been great having you on. We're going to continue this conversation in the smoke-filled room in just a second. Before we let you go, as we said, 7pharmamist.com. Feel free to plug away on anything else you'd like to direct people to.
Okay, great. A few things. One, as you mentioned at the beginning, this is my side hustle. It's not even a hustle. I'm like so much impoverished for doing this rather than just working all the time, but I love it. So I am actually a psychotherapist and a coach. And if that is specifically tailoring to libertarians, it doesn't necessarily need to be that you're isolated because you're a libertarian. I just found that people really appreciate having someone who understands where they're coming from and doesn't think they're mad for being a freedom lover. If that's something you're interested in, beyourselfandloveit.com will arrange a preliminary consultation and see if I can be of help to you. Secondly, I'm going to be at the Greater Reset in Morelia, Mexico, doing a presentation on Big Pharma. Along with, it's run by Derek Rose and John Bush, and there's a lot of really freaking great speakers at that. Not the Great Reset, but the Greater Reset. I know we're not meant to plug tons of stuff, but I've been asked
plug
to.
away. You can plug as much as you want.
You'll know what is for you. Another thing is, I'm actually going to be co-teaching a course on the economics of healthcare reform. And it's kind of bigger than that because the guy who runs it, James Lyons Wheeler, who I mentioned earlier on, is a contact with JFK and RFK, not JFK, and he wants to. We're in our cohort. He wants an outcome of the course to have like a policy document that can be forwarded to RFK. So if you want to be part of shaping the healthcare policy of the future, uh, then that's something that you might be interested in. So that's something we're doing, and I think those are my three plugs. In addition to that, there's the book which everyone should download from 7pharmamyths.com. And thank you for being such a gracious host.
Thank you, Anthony. I'll see you in the smoke-filled room.